there's this thing called step therapy. Now, if you hadn't heard of it before, when I describe it to you, you're going to recognize it. Let's say that there are 3 different drugs that can be prescribed for a particular condition. Well, your doctor would like to prescribe drug C. And the insurance company says, well, we're paying for that. We'd like for you to try drug A for a while. And if that doesn't work, then we'll consider B. And try that for a while. That still doesn't work. Then we'll have a conversation about C. So you can see step therapy there. Again, who's calling the shots about your health care? You get the insurance company. So if you have a good doctor, doctors can go to bat for you. They can ask for things like a formulary exception, maybe something that wasn't covered, or it was in a higher tier and they needed it moved to a tier where you could afford it. A good doctor may be willing to help to make some of that happen. And I've seen some. I've seen some where people had really expensive drugs and they had legitimate concerns about whether that drug was going to be covered or not. And the people in that doctor's office really know how to help those people. And so a good doctor knows how to navigate some of this stuff. Now, what's the difference in a drug plan that costs $0 a month and a drug plan that costs $125 a month, or anything in between? I draw this little XY chart here where you've got the higher the premium, the less out-of-pocket costs you're likely to have, the lower your drug costs you're likely to be. Or maybe a high premium, you're paying high dollars per month, but it's erasing this deductible on the front end. Now, that's very appealing for people who have expensive drugs sometimes.